Question number 3. A 62-year-old man is referred to a gastroenterologist because of difficulty of swallowing for the past 5 months. He has trouble swallowing both solids and liquids, but there is no associated pain. He denies any shortness of breath or swelling in his legs. He immigrated from South America 10 years ago. He is a non-smoker and does not drink alcohol. Physical examination is unremarkable. A barium swallow study was ordered and the result is shown. Esophageal manometry confirms the diagnosis. Which of the following is the most likely diagnosis? I'll show you the options first. Option A, Chagas disease. Option B, esophageal rupture. Option C, squamous cell carcinoma of esophagus. D, gastroesophageal reflux disease. And E is pharyngoesophageal diverticulum. Right. Does anyone want to tell me what is this barium study showing? Quick in the chat boxes. What is this? The rat tail appearance or whatever they call it as. Yes. Okay. Failure to relax, but okay. Very good. Eclasia. All right. So this is basically eclasia. So I'll first clear out the option and then I'll tell you. Like someone mentioned squamous cell carcinoma of the esophagus. Squamous cell carcinoma of the esophagus won't be in the lower part. It will be in the upper part. Firstly, okay. Then someone had mentioned one more, Zenker's diverticulum. Alright, so Zenker's diverticulum also won't present like this. It will be in the upper portion of the esophageal part and it will present something like, I can draw it since I don't have the image. So they'll give you some diagram like this of it comes out as a diverticulum pouch. It's a ballooning out of the esophageal wall, which will be shown very clearly on the X-ray. And what happens here, usually it will be in an old patient with old debilitated patient or something bedridden, and it will be mentioned over here like it's an old patient, and then they'll have halitosis and all that stuff. Okay, so basically by going by the image, we could easily make out it is eclasia. Now I'll tell you what they were trying to tell you. So they are telling a 62-year-old man, he had difficulty swallowing. Okay. He has trouble swallowing both solid and liquid food, which is specific to eclasia. He denies shortness of breath and all that stuff. They have given a travel history from South America. So when they talk about travel history from South America and they mention eclasia, is there some kind of organism that comes to your head? Yes, very good, very good. Yes, Trypanosoma cruzi. So yeah, when they are talking about a travel history from South America and then a person, they might have they can also mention dilated cardiomyopathy or something. Basically, what happens is when the Trypanosoma cruzi, it causes eclasia, megacolon and megaesophagus, and it can also cause a dilated cardiomyopathy or all that stuff. Okay, so that's all it is. And one more question related to eclasia, since you can relate with it. This is how you used to relate and study, so it will be better. So what happens in eclasia? It is difficult for there is a failure of relaxation. There's a tight lower esophageal sphincter, so as a result of this, food gets stuck over here. And you want to tell me the antibodies are again which plexus? The two plexuses are there in your alimentary canal. So which plexus is involved? Would anyone want to try? All right, so it's the myenteric plexus, right? Yes, very good. Okay, coming to one more thing, the drug of choice, more than the drug of choice, the drugs which are involved in the treatment of this Chagas disease. Anyone wants to try before I show the answers? All right, so it's benznidazole and nifurtimox, right? All right. So basically, this is a chronic form. Some people are wondering why 10 years. So Chagas disease can occur in a chronic form also, like 10-20 years. It will be mentioned somewhere over here. The chronic form may develop 10 to 20 years after the initial infection and typically affects internal organs such as heart, esophagus, colon, and the peripheral nervous system. And autoantibodies that target the myenteric plexus, as someone mentioned over here. Okay. And these are the IgG antibodies against the M2 muscarinic receptors, which is not really important. Main thing you have to know, myenteric plexus involved. The treatment is benzonidazole and nifurtimox. That's all you need to know. And this is your barium swallow, which is showing you achalasia. Rat tail sign, as it is mentioned.
Thanks for watching. Please give a thumbs up and subscribe for more.